Good afternoon, everyone. And I wish that everybody is in good health. I'm Elsie, your trainer, and this afternoon we are going to discuss another topic, which is the fundamentals of caregiving. And this is in Module 1. So Module 1 is about vital signs, the standards and principles of caregiving. This is also the content also includes nutrition, fire safety, food safety, infection control, and nutrition. So let me share with you first the slide. Okay. This is the basic healthcare procedure, and this is the very fundamental of caregiving. Now let's first know the standards a caregiver must aim to meet. So a caregiver must carry out the responsibility and knowledge with knowledge and skills, and how to be responsible or how to hold your responsibility with knowledge and skills is to get a training in a reputable training center so that you can gain more knowledge and skills. And this is how you can carry out your responsibility effectively. The next is you can maintain a high standard of personal and health and appearance. So as a caregiver, you must be healthy, okay? You cannot take care of a sick person if yourself is sick. You have to maintain your personal hygiene. Be clean inside and out because you will be taking care of patients. As a caregiver, you must control all negative reactions to chronic disability and challenging work condition. So it means that taking care of elderly and children with disabilities is a challenge. So there are impairments when we take care of elderly, like hearing impairment, vision impairment, cognitive impairment, language, speech, and understanding. So this impairment is a challenge to us as caregivers. Next is be dependable and reliable. You must show respect for the client's privacy. So when you're entering the room of the client, you must knock at the door, wear a smile, and greet your patient. Do not use your client's personal belongings, like their phone, their medication, and food. So you can bring food so that when you are hungry, you have something to take it from your pocket and you can eat privately. Don't use patient's food or phone or medications or other patient's belongings. Do not bring your family and friends to the client's home. Next is maintain safe condition in the workplace. So you must recognize and respect the client's self-determination when regarding their lifestyle and freedom of choice. So don't demand And don't dictate patients what you're going to do. You can give options, respect their preferences, and their freedom of choice. Keep the professional life separated from their personal. So we have all burdens. We have problems, we have difficulties, personal issues, but we have to unload them at home before we face our clients. Let's go to the 5 principles in considering to care for clients. In principle 1, we call this independence. Each person has the freedom to direct one's own life and to do things for oneself when possible. Each person can choose what to do and when to do. And caregiver should not dictate to clients what to do. So this is independence. You have to treat your patient as independent as possible. You are there to assist, to support, and give your patient the freedom of choice. Do not dictate what they have to do. You are there to guide them, to give options, to give preferences, because they have the freedom of choice. Next is dignity. Each person is an individual. So even twins, you cannot treat them once because they have different personality. Each person needs respect, privacy, and should be treated respectfully. In principle 2, client directed. Sometimes your client is not well and she expecting a visitor, or let's say an applicant, but that day she cannot attend to interviews. She cannot interview, she cannot face the client because she is not feeling well. Now she will request you, if you can interview the applicant on my behalf. You can train, you can supervise this person in my behalf because I'm not feeling well. So you are client direct. Next is person-centered. Assistance and support is given when and how the person needs it. Example, a person from another culture wants or may prefer certain foods, but some people may want more or less or a certain drink. So it means that there are clients that prefer a certain food. Then you have to provide that need for the client. And another client in different culture may only want more or less for a treatment. They can do simple tasks. So you are telling them to be independent because they can also provide, or they can eat alone without your assistance. Just provide the things, the food on the table. And there are clients that needs to be assisted by a caregiver. So this assistance is from the caregiver. So you have to feed the patient or feed the patient in a tube. So you are person-centered. Now, what are the role of a caregiver? First, attending the physical needs of a person, like preparing your meals and feeding the client, grooming, bathing, mouth care, perineal care, accompanying clients to doctor's appointments and checkups, running to errands, and also housekeeping. Let us define what is a caregiver. A caregiver is anyone who takes care of a sick person or attending the physical needs of a person. Either this is a child or an elderly at home, in the facility, or in the rehabilitation centers, or even in the hospitals. So let's go to communication. Because in the healthcare, communication is a link between the health provider and the client and also the family. So now let's first discuss what is communication process. Communication should have a sender, and the sender is the speaker. And the one speaking will relay the message to the receiver, and the receiver is the listener. And the receiver should make a feedback or send a feedback to the sender. If there is no feedback or no response, there will be no communication. There are two types of communication: the verbal and non-verbal. When we say verbal, we are using words. When you say non-verbal, we only use gestures, facial expression, head movements, physical space, touching, eye contact. And we have also written communication. This is through documentation. What are barriers to communication? So barriers is one that put a wall between two speakers or two individuals. So what will be the barriers to communication? Poor listening skill. If another person whom you are talking with has poor listening skills, or she cannot understand or she cannot respond positively to your question, or she cannot go in the flow of your interaction. Making judgment. If somebody is judgmental, then you have to close everything. You close your mind from what she's talking. Giving false assurance will also cause barrier to communication. Focusing on yourself. If you are talking to somebody, you only focus on yourself. You cannot see the needs of others. If you are talking to a crowd or to a group and you're the leader, you are just focusing on yourself. You are only meeting your needs, not the needs of others. Discussing your own problems and concerns. So never discuss problems and concern to your client, to the family, and even to your colleagues. You can only communicate to your colleagues in your line of duty. Discussing topics that are controversial, such as religion and politics, is a big, big no. And never use sentences like absence makes my heart pounder. These are statements that are used in poetry, but never used in the healthcare setting. How about therapeutic techniques? When we say therapeutic, these are techniques that can help you grow while you're communicating. These are techniques that are useful, that are helpful, like clarifying and validating. So if the statement is not clear, then you have to clarify. And you have to validate, is this true or not? Or is this correct or incorrect? Encouraging formulation in plan of action. So this is a therapeutic technique that when there are issues inside your patient's house, you have to formulate a plan. A plan in order to solve the problem. Listening and keeping silent is also therapeutic than talking with no sense. Focusing or refocus. So if you're talking to your client, you have to focus in one direction, in one subject, so that your client will understand. Reflecting from the past, especially for a patient having dementia, is very therapeutic. Restating, if the statement seems confusing, you can restate it so that you will be understood. Summarizing. So throughout your shift, your care of action is quite long. So you can be understood by your colleague or by the family, so you can make it brief but complete. Summarize. Providing positive feedback is therapeutic than providing negative feedback. Using broad openings and open-ended questions is also a therapeutic technique. And what are non-therapeutic techniques? Asking the client why. So to make this a therapeutic technique, you have to drop why and replace it with what, when, and how, instead of using the word why. Being defensive also is non-therapeutic technique, and changing the topic, because the one listening will feel that you are guilty. You change the topic right away. You switch the topic. Giving advice of approval and disapproval is also non-therapeutic. So instead, you can give or present to the patient or the client the good things, the best things, than approving or disapproving. Being judgmental is also non-therapeutic technique, and providing false assurance. Now let's go to how to communicate to clients having disabilities. First is conflict resolution. There are times that the family is upset with you without any reason, but don't be upset. Don't be upset with them. If they are talking to you, they are angry at you, just listen intently. Let the person know that what they are saying is important. Do not respond in anger because they are angry at you, or become defensive. Try to see things from their perspective. The family member has also some problems, not only because the mother is sick or a member of the family is sick. Maybe they have financial problems and emotional problems. So we must try to see from their perspective. Next is respectful communication. The most basic form of communication is using your client's name. If your client is Mr. George, then address your patient as Mr. George. Or you can ask your patient, how do you want to be addressed? And for those patients with aphasia, they cannot talk well because of slurred speech due to a stroke. They talk like babies, but for us as caregiver, we have to talk as adults. Vision impairment. Visually impaired people can often be quite independent. So when you're approaching your client, you must call them by their name. Okay, you call them by their right name. Do not touch their guiding dogs, especially if they are walking at the park. Never touch their guiding dogs. Ask the client to hold on to you instead of holding them. Okay, so that is one of the techniques. Psychologically, when you are walking together, you want to hold the hand of your companion so that you may make sure, or you should make sure, that you will not get lost. And that is also the feelings of our elder. Let that elderly hold to your hand, then holding their hand. When walking into the room, we must identify ourselves. When your client is seated at the end part of the hallway, because they have vision impairment, they cannot recognize you immediately, then you can identify yourself while walking towards your patient. How about hearing impairment? There are things that we have to consider. First, consider a signal. Wave of your hand, you tap the shoulder of your client, or another signal, so that the client will know that you have something to say. Speak clearly and slowly, don't shout, because the more you shout, the more they cannot hear you. Give the person time to understand and respond. Be flexible in your language. You can write or rephrase it. If they cannot hear, so you can write in a piece of paper, they can read. Look directly to the person while speaking, expressively, because they will know the meaning of what you are saying through the opening of your lips. When there is an interpreter accompanied by the client, while speaking, don't look at the interpreter. Rather, you must look or speak directly to the client. Encourage person to socialize and keep hearing aids open. Language impairment. Some people cannot write but can't speak. So before that, another signal. Get the person's attention before you speak, like waving a hand, tapping a shoulder, or another signal. Get the person's attention through a signal before you speak. Reduce background noise. If there were extra noise, like when your TV is on, the music is ongoing, so you must turn off or lower down the volume of your TV. And you can use simple sentences answerable by yes or no. Do you want to eat? Do you want to go out? Do you want to go back to your room? So those are questions, answerable by yes or no choices. And use different communication technique like drawing, also gestures. And give positive feedback. Don't criticize or correct that client. For mental health impairment, for mental health, they can hear voices, they have behavioral impairment. Consider watching TV, listening to music, read a book, or playing cards. Allow the person to have a personal space in his room. That person should be alone in his room. You cannot mix that person with mental health impairment to those without impairment. Don't stand over him or to get too close. Don't block the hallway. Try to remain as calm as soothing with a soothing approach. And when you're speaking, you have to speak in a low tone voice. Never shout at them. And you can use simple sentences. This is to avoid confusion. Establish a structured and regular daily routine. And that schedule that you have structured must be predictable. You must be consistent. Don't say that you will do it, then change your mind. Next time, that person will not follow you anymore. You must praise that person continually. Avoid stimulation so that their stress and tension will be reduced, and respect his or her feelings. So when they will say, I saw somebody inside the room, but you cannot see them, just respect their